Thank you so much for joining us here on the H.I.T podcast. This is part 2 of my conversation with Kirk from Garner. If you missed part 1, that was last week's episode. It is a fascinating conversation, fascinating product. This week's episode is brought to you by Montage Insurance Solutions. And without any further ado, let's pick up where we left off with Kirk from Garner. Anything you can do to impact specifically monetarily, and more importantly, without quality. So for the right reasons, you want your employee back to work, you want him or her healthy, you love that employee. And also it's so impactful for the bottom line.
Totally. I mean, I think, what we've seen over the last several decades is that a lot of employers and a lot of brokers are ultimately coaching these employers to kind of kick the proverbial can down the road by making Band-Aid fixes that are, going to adjust costs. And ultimately those are 1-year fixes. They're not something that's going to sustain trend improvements over time. And those are the types of things that are just no longer going to be an option for many employers, because as healthcare expenses continue to escalate, it's actually going to threaten the ability for businesses to be competitive, to have profitability,
Totally.
really to be able to actually even sustain and not have to hit a level of bankruptcy. So we kind of look at it as that without a fundamental shift in how businesses purchase healthcare and focus on sustainable outcome improvement and quality and process improvement, many companies are actually going to face a new financial crisis. So we've got sort of this one end of the spectrum where companies are in big trouble if they continue to sort of leverage the same traditional cost share approaches that they've put in place to manage costs. And you've got this other side of the spectrum where employees are just getting crushed right now. We often think about the plight of the American family having to manage increased cost share every year and increased out-of-pocket expectations every year. Literally, there is a large percentage of the population in America that is truly covered through an employer-sponsored plan, but functionally uninsured because of how high these deductibles are, because of how expensive these out-of-pocket maximums are right now as well. So, we really feel like this is a crucial tipping point for an organization, we believe Garner, to step in and ultimately support both the cost side of the equation in a sustained way, but also really improve the affordability side of the house for employees. And we think that's a really good play on retention, on attraction, and ultimately managing, overall profitability and competitiveness of an organization too.
Yeah, I think we've done a decent job of explaining kind of fundamentally what Garner is and kind of why the problem and why the solution, but getting into like a little bit of the mechanics, right? And so to say like, okay, fine, you point my employees to some doctor, I get that. Like, how do you do that? And my employees aren't going to use this sort of a thing. Love for you to kind of talk a little bit about number one, engagement. Number two, kind of just literally the mechanics, right? So adding the deductible and steering people.
Yeah, so I recognize that a lot of employers have put in solutions over the years where they're just frustrated by the lack of engagement. And, we didn't do this study, Harvard did this study, but ultimately what Harvard found is over the last several years, as you think of companies that are putting in solutions to manage costs, whether it's a Center of Excellence program, whether it's digital nav programs, whether it's more of those legacy types of transparency solutions, they're low friction to implement, but they're only getting anywhere from 3 to 8% in a good year engagement. And what we find and what we're excited about is that given our mix of mechanics, we're actually driving almost 1 out of every 2 employees that are offered Garner to use our tool to find a high-performing doctor and then go to see that doctor and have really good care and really good outcomes at the end of the day. So, you sort of alluded to this a couple of minutes ago, Toby, but we really look at Garner as a simple plan addition. So we sit on top of any carrier, any network, any plan design. We take this really accurate set of data analytics on doctor performance. So who are the best doctors in a geography that are, number one, in network, but number two, really importantly, doctors that are still accepting new patients, and you're not going to wait to see somebody for 12 months down the road. So let's take that data on doctor performance, and then let's marry that and pair it with an innovative incentive account. So if I'm a member and I use Garner to find care, whether it's through our app, through our website, through our telephonic concierge team, and
all of which are super easy. Sorry to cut you off, but it's like, hey, look, guys, how do you think your employees are finding doctors, right? They're doing something. They're going to Yelp, they're going to Google, whatever. So Garner's a very easy to search tool. Sorry, keep going.
Yeah, no, I appreciate that. So let's get somebody to use the tool to find high quality care, because if they do, that's going to drive the cost of that episode down by 27% on average, which is not negligible. That is significant. But the way that we actually get them to use that data, unlike a lot of the other solutions that have been out there in the market with low engagement, is that we give them a really, really innovative incentive account that's going to drive those members to the best doctors in the existing network. So literally, if I use Garner to find care, I will get a list of doctors that are high performing surface in my list. If I go see one of those doctors, or if my family members go see one of those doctors, and I have any eligible out-of-pocket expense, so we're talking office visits, we're talking lab work, imaging, physical therapy, surgeries, prescription drugs that are prescribed by one of those doctors that Garner recommends and surfaces, those expenses are all reimbursable back to the member. So what it really does, Toby, is like, I always like to say this kind of like flips the concept of traditional insurance on its head, where so many people are used to having to meet a deductible and then having co-insurance kick in, and then at some point an out-of-pocket expense. And we're talking about, in many instances, thousands of dollars of out-of-pocket expense that someone is responsible for when they get care. On the flip side with Garner, I don't have any out-of-pocket expenses at all until I fully exhaust an incentive that my employer puts in place if I go to see the highest performing doctors in the network. So suddenly you're talking about 95% of people on an average year not having any out-of-pocket expenses at all if they're using Garner to find care. And by the way, they're also having really strong outcomes, and they're saving their employer a ton of money because they're seeing those doctors that are driving down the cost of an episode.
So let me repackage some of this. So upwards of nearly half of the members offered Garner per year data will utilize it. It's not difficult to get them to utilize it. Upwards of 40+% of folks offer Garner will utilize it. 95% of those will then have episodes of care where they do not experience out-of-pocket costs, and employers are saving about 27% on their planned care spend.
27% per episode of care. So when we combine that 27% per episode of care, again, we're talking primary care, dermatology, OBGYNs, all the way through surgical oncology and interventional cardiology, anything in between, we see an average savings per episode of 27%. So when we combine that 27% average savings per episode and that 45% engagement every year, that's driving down employers' average spend on a net basis by about 12% per employee per month.
Net
so
meaning
really
after they pay not only any Garner fees and stuff to get access to it, but more importantly, the incentive account. So you're telling employees, hey, you guys have whatever, 1,000 out there, 2,000 out there that we as an employer are going to set aside that you can have access to if you just use the search feature. After funding all of those accounts, after any expenses, there's a net savings on average for employers, right?
Yeah, I mean, again, I kind of sat on your side of the table for almost 20 years myself. And the reality is it's very hard to find a solution that's out there that creates a win for the employer at the same time you're creating a win for the employee. Those things are typically the inverse. What we're able to kind of demonstrate here, which I think is really novel and what got me very excited to come to Garner from the consulting side, is there's a clear win for the employer because we're driving people to doctors that are saving that plan a significant amount of cost. And we're also then driving a really, really significant out-of-pocket expense reduction for employees and their families at the same time. So to me, that's a really, again, a novel sort of an approach in the market. And so much so that we often have conversations with brokers, with consultants, even directly with employers to say, like, why wouldn't we do this, right?
Yes.
Like, it almost kind of feels too good to be true that we are saving money from a plan spend perspective. We're able to actually get better rates from our fully insured carrier if we have a fully insured medical plan. And at the same time, by the way, our employees have virtually no out-of-pocket expense at all if they see the best doctors in the network. So this really, really compelling win-win equation that I think we're able to offer in the market.
And here's what I'll say is, in a recent conversation I was having with a self-insured client about Garner, I'll give you some of the pushback in case other people out there were fielding as well. They said, okay, well, what about from a cash flow standpoint, right? People are out there go, no, here's the cool part. It's billed on just a flat per employee per month basis. So you're not having to fund the sort of HRA, for lack of a better word, as claims are utilized. There's no sweeping. We just pre-estimate the claims that you're going to fund and charge a flat fixed per employee per month, which, by the way, if you're worried, if you get a bunch of utilization, great. Your plan spend will go down. Your employees will go to better places. If you don't, all this billing along the way that Garner was doing in this case, and I don't know if it varies by client, so maybe you can specify, but in this case, Garner's willing to give back 80% of the claims funding to the employer at the end of the year. If they say, hey, look, we had you set aside X amount per employer per month to fund all these claims. Darn it, you were right. You were this weird outlier case where nobody used Garner, so all this money you set aside was just sitting there. Here's 80% of your money back. So you're really not risking that either.
Yeah, no, it's super, super valid that you brought it up. So we like to say Garner's taking on all the downside risk. So we're charging an employer a per employee per month. That per employee per month is going to cover our admin fee, the cost to kind of keep our lights on. And it does cover essentially the employer's liability as it's tied to that incentive account. So we take all the downside risk. If all of a sudden, to your point, every employee in that population uses Garner and maxes out that incentive, we are fully on the hook for any of that overage at Garner. We're not going to come back and bill the client at that point. At the same time, that client's going to really benefit from more people going to higher performing docs. That's going to really improve their trend in a sustained way. And what we do find on average is that our renewal trend across our book of business is somewhere between 2 and 3%. That's compared to national averages trend rates of 8, 9, 10% when you combine medical and pharmacy. And then the cool thing is that the employer does share, to your point, Toby, in the upside risk where we're reimbursing 80% of any surplus remaining if that employer did not have the type of engagement that we were projecting for that year as well. So really not a major loss opportunity for an employer. They know what their costs are. It's going to be very predictable going into the year, and then they will share in any of that upside surplus that exists at the end of the year if it does. Now, I will tell you, our team does a really good job across our book of understanding what the expected spend is going to be. So it's not very often that we have to pay out a surplus, but that protection is always there.
Yeah, and as almost just a rebuttal to what might be someone's headwinds to hearing this conversation, and specifically in this group's case, what they said was, here's what we want to do, Toby. We're going to add $1,000 to the deductible of all of our plans, and we're going to fund Garner $2,000, right? And so the employees are all told like, hey, listen, you really want to get on board with this Garner thing because we're adding $1,000, but we're giving you $2,000. So you're so much better off than where you were before. But the reason I bring all this up is what they thought was, well, here's what I'm risking, Toby, is I get billed this per employee per month. No one uses it, and I only get back 80% of my surplus instead of all of it, except for the part where we saved on premium equivalent rates because we added $1,000 to the deductible. So actually the plan we bought underlying all this was cheaper in the first place. So now the risk gets mitigated even further.
Totally right. And by the way, just in that scenario that you just mentioned, so increase the deductible by $1,000, add a Garner incentive of $2,000. Our historical trend reduction that we're seeing after we account for what Garner gets paid, after we account for the incentive itself, is 10% savings. Yeah. So you're not getting 10% savings just by increasing that deductible by $1,000. That's part of it, but you're getting a significant amount of that savings by those employees and their family members going to higher performing docs because of that rich first dollar incentive that they have access to reimburse any of their out-of-pocket expenses. The cool thing is, though, is that if you are a group that's not looking to make plan design changes, but you do still want to have savings, we're able to actually commit to what we call our overlay model, where we literally come in and we say to you, don't change your carrier, don't change your network, don't even change your plan design or your plan designs. We're just going to overlay an incentive to make it that much more affordable for your employees and their families to see high performing docs. And we're typically seeing a 4% savings on net of incentive, net of Garner fees on medical and pharmacy. Right. So that is a significant amount of savings that a client can get by not making any plan design changes at all, instead just making the benefit that much more affordable. So what a different type of message that would have been for me to take to a client when I was still on the consulting side. It's very, very, very rare that something like that would exist.
And for the CFO out there that's going, yeah, but to do that, I'm $1,000 per head on the hook. I've seen this plan, and you correct me if I'm wrong, in the range of, I don't know, what is it, like 12 to 15 bucks per employee per month, something like that, where it's like, no, you're on the hook for $1,000 per head. You're on the hook for whatever it is, 15 bucks per employee per month. And again, if it's not used, we'll return 80% of the surplus.
Yeah, you're 100% right. Some people are going to fully exhaust the $1,000. Others are going to use a portion of it, and some are not going to use care at all throughout the year. So ultimately, we see somewhere around 30% of the maximum incentive liability actually be exhausted, and that's how we ultimately set those monthly per employee per month rates that you're talking about, Toby.
Well, we're out there talking to our clients about it, as you know, and if anyone out there is interested, you can certainly talk to us about it, or even talk to your own broker about it. But it's an interesting solution that, as you said, nets savings. So yeah, you're putting some money into an incentive account. Yeah, you're paying Garner a couple bucks to access their billions of data points and get your employees to better care. But you should see net savings, and Garner's putting some of their claims funding at risk to do it. So I think we did a good little nutshell for employers out there listening. Anything you'd want to touch on before we get out, or do you think we hit most things, or any parting thoughts?
I would just say what I think is really cool about this, and I kind of use this line often every day, is that generally the couple of things are agnostic to the size of an employer, agnostic to the geography of an employer, agnostic to the industry of an employer. Most employers, if they were told, hey, we can get you something that is going to save you money on trend, but do so in a sustainable way year over year, that is going to improve the affordability for your employees and their families and put money back in their pocket. And then just like philosophically get people to use the best care within their existing network in a non-disruptive way. Like that sounds pretty good. So what I think we're really, really excited about is just the vast diversity of clients that we're working with within our book of business, and would be excited to have conversations with anybody about what a solution like this could look for them and for their employees.
Well, as you said, you say this with 16 years of experience as an executive at a name brand insurance consulting firm that believed in it so much, you literally jumped ship. I have about 18 years of consulting here at Montage and believe in it so much, I want to bring it on the podcast. So it is that kind of rare, good for the goose, good for the gander, just really well thought out, data-driven solution.
Thanks, Toby.
Thanks, man. Thank you so much for being on, Kirk. I really, really appreciate you. Thank you guys for joining us. Thank you to our sponsors, TrueHue. Join us next week. Join us every week. And until next week, make this the best week yet.